Hello and welcome to Unleashed, the show that explores how to thrive as an independent professional. I'm your host, Will Bachman, and I'm here today with Betsy Seals, who is the Principal and Chief Operating Officer and one of the co-founders at Rebellis Group. And she's going to tell us all about their work. Betsy is a nationally recognized leader in the managed care industry. Betsy, welcome to the show.
Hi, Will. Thanks for having me.
Okay, so my first idiot question is, help me understand, what does managed care refer to?
So, really, anything that is either federally or state regulated is what we mean by the term managed care. So, for example, the best example on a national level is Medicare Advantage, which essentially takes the same federal dollars that are in, fee-for-service Medicare and takes those into the private sector, and really with the idea of offering better benefits and a better product to Medicare Advantage beneficiaries or to Medicare beneficiaries.
Okay, so if I have just a regular private health insurance, we don't call that managed care.
No, we typically call that commercial or IFP, or there's probably a number of different names for private health insurance.
Okay. So for listeners that, like me, or I'm a listener, I guess, who maybe haven't yet reached the age where they're really trying to study the different Medicare options and they're maybe a little bit fuzzy on it, explain to me in simple lay person's terms, what is Medicare Advantage?
Sure. So we'll start with what is Medicare, right? Because then that's going to feed into the question. Essentially, Medicare is the federal health insurance program that we all pay into all the way up until we are eligible, which typically happens when one is around one's 65th birthday, or in some circumstances related to certain disabilities at a younger age. And so at that point, all of that money that we've paid through all of our careers, it's just put into the federal healthcare program, turns into benefits, right? Our Medicare benefits. And what we call fee-for-service Medicare is generally looks like the beneficiary paying 20% and Medicare paying the other 80. What Medicare Advantage is essentially private health insurance companies who have a contract with the federal government to take those same federal dollars and provide a better product, higher level of benefits, supplemental benefits like transportation, over-the-counter drugs, a lot of different things that is not covered by original Medicare, essentially managing those dollars in a more effective way to give the beneficiary a better product.
So if I've turned 65, which is still a few years out, then how does it work? Do I have a choice? I can say, no, I'll just stick with basically plain old vanilla, plain Medicare, fee for service, and I'll pay 20% of anything. Or do I can go out and sign up with a Medicare Advantage plan, and then I have to pick which one of several providers that I want to sign up with? Like, how does that work? How do I get into a Medicare Advantage? And then I have to sort of say, all of my benefits basically will go to that insurance company and they'll provide me benefits, but I kind of relinquish my right for the fee for service. Like, how does it work?
Yeah, so when one is initially eligible for Medicare, they go and sign up, Medicare Parts A and B, and then they essentially have a choice, right? They either are in fee-for-service Medicare and they have a prescription drug plan on top of that for the Part D coverage, or they can choose to join a Medicare Advantage plan, which typically has all of the benefits wrapped in one product, also referred to as Part C. So it's typically A, B, and D, all of your Medicare benefits within one product, and then managed under that product as well. And then in terms of, sorry, the next part of your question, I know we're gonna edit that piece out.
Yeah, no, that's all right. I mean, we're very casual here on the show, so
Yeah.
uh, so I get to choose that, and then so if I pick a Medicare Advantage plan, then all of the dollars I guess they just get like a fixed amount of dollars from the federal government. Say, okay, Will Bachman, he was going to get so many dollars, on average, of benefits. So all of those dollars go straight to that healthcare company.
Yeah, so the payment around what those Medicare Advantage companies get is much more complicated than that. It has to do with their star ratings. It has to do with their risk adjustment. So a lot of pieces around how that company gets paid. What it turns into for the beneficiary is really a couple really key things. One is an out of pocket max, very specific and regulated copays around different services, so you know exactly what you're going to pay when you enroll in that Medicare Advantage plan. Which, by the way, we are in annual enrollment period right now. Marketing started on 10/1 and enrollment starts on 10/15. So now is the time when all the beneficiaries are really reviewing their options. So that's how that looks from the beneficiary's perspective. In terms of what plan type, because there are a lot of different plan types, just like in the commercial world, there are HMOs, there are PPOs, and a beneficiary has choice. So typically, a Medicare beneficiary is either going to contact their local agent, sales agent, or they're going to go to Medicare.gov and take a look in their zip code at what plans are available. And it really gives a great picture of the cost associated with those plans. You can input your prescriptions to see what you're going to pay for each of those prescriptions. And really, that's at least a way to do some due diligence and educate yourself on what new plans are in the market starting on 10/1, which will be live on 1/1 next year.
Okay. So sounds relatively complex to make this choice. Um, so, I guess it's a good thing that it's not just a straight dollar per person, because that would drive the insurance companies to only recruit the really healthy 66-year-olds as opposed
Mm-hmm.
to the person with pre-existing conditions and so forth. So I guess they get paid more if the person is like a sicker person.
Yeah, so a couple things. What we call cherry picking, or targeting certain subsets of individuals based on their health status is prohibited by federal regulation. So we definitely are very careful not to do that in the Medicare Advantage world. We can't ask any health screening type of questions when we're enrolling beneficiaries. But I will say that how those beneficiaries are managed once they're a part of the plan has a great deal to do with how successful that plan will be. If you as an organization are really great at managing a diabetic population, you have a lot of different programs and outreach efforts and benefits to wrap around, a specific disease state, you're going to be much more healthy as an organization than if you are enrolling beneficiaries with all sorts of different chronic conditions and you're not managing any of those appropriately or effectively. So the management of the beneficiary and those chronic conditions after the point of enrollment is absolutely critical for a health plan's success.
Okay, great. So now I at least have a beginner's knowledge of what managed care is. Tell me a little bit about the types of clients that your firm serves. Is it mostly the for-profit insurance companies that are running these Medicare Advantage programs, or is it the government, or some third choices, or all of the above?
Yeah. So probably the real answer is all of the above, but I would say our core client is a Medicare Advantage health plan, whether it's for profit or not for profit. So that would be our kind of our core client. And then in addition to that, we essentially have clients in all different areas of the business. What we've noticed recently is a lot of different, for example, tech companies entering the space because there's a lot of money to be made in healthcare, right? But just because you are successful on the tech side and you have a great idea does not necessarily mean that you understand the Medicare Advantage or the managed care landscape, and certainly doesn't mean that you understand all the nuances of the regulations, which apply equally to any type of technical solution. So more and more, as the industry has evolved, we have found ourselves working with those companies who have a really great idea of how to change healthcare or be innovative in the healthcare space, but really don't understand the landscape and don't understand the regulations. So that's been a lot of fun. The other place I'd say that we play is that there's a lot of private equity firms really investing in the space. A lot going on in managed care, Medicare Advantage specifically. And so doing due diligence or kind of providing advisory services to those PE firms has been a new piece of our business, which has been a lot of fun as well.
So, beyond the due diligence for PE firms, could you give me some, obviously sanitized, but examples of actual types of projects that your firm has done?
For private equity or for in the industry?
For industry, let's start there.
Yeah, so let's take the example of for our typical project for a Medicare Advantage company, right? Medicare Advantage health plan. A typical project for us would be, for example, benefit administration testing on Part D. So we all get a new formulary starting 1/1. We need to make sure that those benefits are tested, that the beneficiary, Mrs. Smith, when she goes into the pharmacy on the first of the year, that she is going to get her prescription and she's going to pay the right amount for that prescription. And a lot of work and effort goes into making sure that that happens on 1/1. So that would be a typical project for us. Performing a mock CMS audit. So CMS audits these contractors each year, and on a different cycle, but certain organizations are audited each year, and the outcome of those audits can mean, great, you passed, you're doing a good job, or they can mean that you're being slapped with a fine or a sanction, and in the most egregious cases, contract termination. So they really, really mean a lot to these organizations, and doing well in an audit and being prepared is very important. So we conduct mock audit services to prepare our clients for that CMS audit, and we also conduct audit preparedness. So if they get their audit notice and they would like assistance from folks who have been through it hundreds of times before to really help them through the audit, that would be another kind of typical project that we would assist with.
And tell me a little bit about what a mock audit does and what an actual CMS audit would look like in practice.
Sure. So a CMS audit, a program audit, looks at a couple of key areas. For example, compliance program effectiveness, formulary administration, coverage determinations, appeals and grievances. So really, based on back in the day when I first started in the industry, CMS would come in and audit every single area of a health plan, pretty much. They've really pared back their auditing to those areas that they view as having the most beneficiary impact. So for example, formulary administration, right? Is the beneficiary getting his or her prescriptions on time and paying the right amount? Appeals and grievances, does the beneficiary have access to his or her appeal rights? So those are really things that are there to protect the beneficiary and ensure that that beneficiary has access to the benefits and there are no barriers to care. So what our mock audit process does is really the exact same thing and process that CMS would follow. We're going to provide the audit notice. We are going to provide the universe requests. We're going to do everything in the same way that CMS would in order to give our clients that real experience, the dress rehearsal, if you will, prior to the show. The only difference that we would have in our process is that along with conducting the mock audit, we also have our consulting hat on, right? And be able to advise our clients, okay, you guys did really great in this area. These are the recommendations we'd make to perform well in a CMS audit in these areas. So really kind of wearing both hats of providing the real experience and then also providing recommendations along the way.
And how do you and the CMS do, for example, the formulary administration? Would they ask something like, show us the last 100 times that a patient went to the pharmacist and what happened, and then they pull one at random and try to pull the thread, or like what do they actually do?
There are a number of different pieces to the formulary administration. And to be honest, that since I'm not a pharmacist, I do not review those cases. I probably can't answer exactly the process without looking it up.
Or pick a different one, like a different part of the audit that you're familiar with.
Yeah. So for example, on compliance program effectiveness, one of the areas that is a newer area is what we call a tracer sample. So it's exactly what you've said, right? We're going to pick an issue and then we're going to dig into that issue to find out exactly what the organization did along the way. Did they do a root cause analysis? Did they have all the documentation in place in order to document their investigation and findings? Was there corrective action put in place? What was the result of that? So really looking at a deep dive in how the organization is responding to issues is kind of at the crux of the way that CMS is auditing today.
And how do you stay up to date with the latest and greatest of what the CMS is doing? Like, do you go and talk to people that have just been audited to say, hey, what did they ask you this time? And how do you stay up to date on that?
I think there's a couple of different ways. Certainly, I've been in the industry 18 years, and I think my first year in compliance, we were audited. And I've probably been involved in audits or audit remediation every year since then. I also worked as a CMS subcontractor performing program audits. So part of it is just that built on knowledge that we have from performing and being involved in so many different audits. CMS does release an audit protocol each year, and they detail how they've modified their auditing protocol from the previous year. So that is certainly very important to take that and ensure that we understand the edits and have the updated documents and all of that. CMS also does provide us with a number of different kind of reports around their findings. If they apply a money penalty because of noncompliance, those reports are all publicly available. So just really knowing where all the little pieces of information are to build on your historical knowledge and really have the most up-to-date information that's happening right now is kind of our job as consultants, right? To know where to look and to be the most up to date and knowledgeable on the process.
Do effectively every managed care plan do one of these mock audits? Is it almost like typically a CEO or just a board requirement that you do one, or is it just only a small percentage do? I'm curious how commonly it's done.
I wish that it were all Medicare Advantage organizations that did a mock audit. I think, unfortunately, with compliance, a lot of times organizations don't place the importance that is needed until they go through an audit and it doesn't go well, or until they receive a notice of noncompliance. Because unlike a lot of different areas, for example, risk adjustment or STARS or PDE reconciliation, a lot of the projects that we perform, we're essentially going in and helping that client find money that's being left on the table, right? And those types of projects are always going to be at the top of any CEO's list of things to get done. With compliance, you're typically never finding money. What you're doing is mitigating risk. And so often it's those CEOs who've really been in the industry for a while, or those compliance officers who have been in the industry for a while, who understand the importance of preparing and of being compliant. Because unless you've had or experienced kind of an adverse event because of noncompliance, really understanding the risk there is not easy.
Can you share us any, obviously sanitized examples of things that you found that would have been like really bad if the CMS found it and then the company was able to fix it? Like any examples of things that were just like totally non-compliant?
I There's a number of examples that I could give you, but I will tell you that the things that we've seen, in my 18 years and 14 years in consulting, have been almost things that you could never imagine. Closets full of unpaid claims,
Wait, what?
compliance. Yeah.
What?
Oh yeah. Oh yeah. Closets stacked with
Oh my
with
God.
claims that were unpaid. Compliance officers ripping up documentation in the ladies' room. I mean, it's anything that you could imagine. We've seen it all. So never surprised anymore.
That's a classic. Oh yeah, that's
Yes.
our unpaid claims closet. That's where we just throw the claims when we
Yep.
don't feel like processing them and want to
Yep.
golf that day or whatever.
Yeah. Joe's on leave. He can't get through those this year.
Those poor
Uh-oh.
people. You just think about these people who didn't get their claim paid. Oh my God.
Yeah. As absurd as it sounds, really, I started in customer service. So whenever I'm approaching these projects, and I think a lot of folks that are in the industry kind of started, on the clinical side, with patients or on the pharmacy side with patients, I always have that voice of the beneficiary in my head. So the way that we approach our work is, of course, to help our clients, but also all of our goals in this industry should be to serve the Medicare Advantage beneficiary. They are a vulnerable population. They're either over age 65 with chronic conditions or under age 65 and disabled. And my personal perspective is if you're going into Medicare Advantage, you have an obligation to, of course, do what's right from a business perspective, but ultimately to care for the beneficiary in the best way possible.
Now, your firm has quite a impressive roster of talent. If you go on
Thank you.
your website, you can click on, I think, team and see a really impressive range. Tell us a little bit about the types of folks that you have on the team.
Yeah, so we have 4 owners on our team, myself, and my background is in compliance and operations and consulting. Deborah Devereaux, who is co-founder, and she is a pharmacist, and she has been in the managed care industry for years and a practicing pharmacist longer than that. Charo Knight Lilly, who also kind of grew up in managed care. She's worked for a number of large players, has been compliance officer for a Medicare Advantage plan, also worked in consulting for a number of years. April Fleming, who is also grew up in Medicare Advantage and managed care, also spent many years in consulting, but she's kind of our technical wizard, I like to tell her, because she also is very tech savvy and has built a lot of products in the industry. So we really lean on her for that innovation perspective in terms of an idea and what's possible.
And then you have a bunch of, I think, subcontractors that you have sort of as a pool of talent available to pull in to projects, right?
We do. We have contractors as well as W-2 employees. And the way we kind of structure our firm is that we have a person who corresponds to any area within a managed care or Medicare Advantage company. We have, for example, pharmacists who are expert in managed care. We have clinical RNs and physicians who are experts in managed care. We have certified coders, risk adjustment experts, compliance experts. So really, I like to tell our clients, anything that you could possibly need in the Medicare Advantage world, I have somebody who can help you with that.
Fantastic. So, Betsy, where can people go to find out more about your firm? Where would you like to point them?
Rebellisgroup.com is our website. Also, we have a blog on our website where we kind of provide key updates, as well as LinkedIn, our LinkedIn page.
Excellent. And we will include that link in the show notes. So, Betsy, thank you so much for joining today and teaching me about Medicare Advantage, managed care, type of work you do. And now I know where to go for a mock CMS audit. It was really great having you on the show.
Absolutely. It was great to be here. Thank you.